Health visitors are specialist public health practitioners, nurses or midwives who have undertaken an additional degree on top of the basic nurse training. They are identified as being the key lead in delivering the Healthy Child programme for children from birth to school age and improving their outcomes. Blackpool Teaching Hospitals has recently embraced the opportunity to increase the number of health visitors as part of the Health Visitor Implementation Plan and the Government's call to action. We have worked closely with the University of Cumbria in order to achieve this. Blackpool Teaching Hospitals health visitors are people-centred, positive, compassionate and achieve excellence in everything they do. Together we care.
The main part of my role is to deliver high quality, good services to families and children to achieve positive outcomes for those children. We have 4 levels of service. We work on a universal service, which is a service that everybody receives. They receive 5 key visits within their time that we're involved with them. The first one is at an antenatal visit, the next one between 10 and 14 days following the birth of their baby. The next visit is between 3 to 6 months. We then visit between 6 and 12 months and 2 to 2.5 years. So there are 5 key visiting pattern areas that everybody within a universal service receives. Our next step is Universal Plus. These clients receive the same 5 visits but will maybe need some extra support with issues such as breastfeeding, perinatal mental health, weaning, or any other issues that they're having difficulty with, maybe behaviour management of their children. Universal Partnership Plus is our next level, and these children and these families may require some extra services that we can't provide. So they may be involved within a child development centre, specialist areas, children's centres with whom we work very closely and collaboratively, and these children and families are in receipt of a number of services. The 4th level of our service is safeguarding. In some areas there will be a small percentage of health visitors caseload, but in other areas where there is social deprivation, this will be a great part of their work, where health visitors will work collaboratively not only with children's centres but with social workers, social services, and they'll attend a lot of meetings as well as actually delivering healthcare to these families.
Even though Reed is not my first baby, I got the same amount of support as if he was. The health visitors supported me with depression after having Reed by contacting my GP and also home visits for talking sessions, which really helped.
My name is Jackie Finan. I'm a health visitor in Lancaster and I have a development role within health visiting. We're here today at Rylands House in Lancaster to deliver the National Ages and Stages training for health visitors. The Ages and Stages training is a parent-led assessment of age-related development of their child. The questionnaires help parents and professionals work together to review 5 areas of their child's development. The assessment will take place between 2 and 2.5 years initially, and this will create a population measure of children at this age.
My name's Sam Whittle and I'm the Programme Lead for Specialist Community Public Health Nursing and Senior Lecturer for Health Visiting at the University of Cumbria's Lancaster campus. Each year, in close partnership with the local trust, we train approximately 10 health visitor students. The recruitment and selection procedure is held in partnership with the local trust, ourselves and most importantly, local parents. The course is offered on a 50-50 basis, so that students are offered a balance of a broad range of practical experiences and a sound academic base. The trust provides each student with a practice base, for the duration of the course alongside a dedicated practice teacher and mentor. The university provides a rigorous curriculum which encompasses evidence-based practice, public health in practice, facilitating health behaviour change and safeguarding alongside health visitor specific study days. The support and guidance that students are given throughout the year ensures that we produce a high standard of qualified health visitors currently entering employment throughout the county and the country.
My name's Anne Hollings-Tennant. I'm a health visitor and I qualified 6 months ago.
My name is Amy Davis. I am a health visitor as well. I qualified about 3 months ago.
We've both done a year's training to become health visitors, both come from nursing or midwifery backgrounds, and we then have gone on to do the year's training. Since then we undertake a preceptorship for 6 months after qualifying, in which we're supported on a monthly basis by an experienced health visitor. Throughout our career we also have supervision, both safeguarding and clinical supervision with our peers.
So one of our key roles is to build up a relationship with the families we work with. We know that the time from conception through their early years is such a crucial time for children and their long-term well-being. We start working with mums in the antenatal period, and then we see children at home for routine visits up until they go to school. We also see children in clinics, we see them in children's centres, and it's a really good opportunity to have ongoing contact with the families.